Welcome to the first in an occasional series of webinars to be delivered by members of the Health Foundation's International Network for Improvement Science. Our topic today is an important one: how to write about quality and safety and get published. Good afternoon if you are joining us from the UK or South Africa or Holland or Belgium. Good early evening if you're in Norway or Sweden. And good morning if you're in the US or Canada. Just to let you know, we already have questions bubbling up, and a colleague in Belgium has asked us whether the presentation will be available after the webinar. It will. Shortly after Mary Dixon-Woods has finished, the whole presentation will appear on the registration website. And I'm delighted to say that the webinar will be recorded and will appear on the Health Foundation's website shortly afterwards. We will email you all with the link for that so that you know when that's happened. My name is Bill Lucas, and it's my privilege to be facilitating the session today. In a moment, I'll introduce Mary to you properly, but before I do so, just let me explain the format we will be adopting. The whole thing will last for about an hour, with Mary talking for about the first 40 minutes, and then question and answers for the last 15 minutes. There may well be questions and answers that we cannot touch upon, and we'll do our best to deal with those in conversation on the Health Foundation website subsequently. It's now my great pleasure to introduce our first speaker in this important series of webinars. Mary Dixon-Woods is a member of the Health Foundation's International Network for Improvement Science. Mary is Professor of Medical Sociology at the Department of Health Sciences, School of Medicine, University of Leicester, here in the UK. Mary has published more than 100 peer-reviewed articles, 1 book, and 5 book chapters. She has extensive editorial experience from which we look forward to drawing. Mary's topic is how to write about quality and safety and get published. Mary, the virtual floor is yours.
Thank you very much, Phil, and hello everyone. It's really a great privilege and pleasure to be with you on what's a very wet and miserable afternoon here in the UK. Now, as Phil says, I've been writing and editing in relation to quality and safety for quite some time. So what I hope to share with you this afternoon is the knowledge that I've gained from trying to do that. What I'm going to explain are some really quite simple rules that often are neglected and mean that people don't get published when really they should, when they've got something really interesting to say. So I'm going to keep repeating this for the next 40 minutes, and that's the importance of having a story. The presentation I'm going to give you today is really going to be in 2 parts. For the first part, I'm going to explain some general principles behind writing, and then in the second part, I'm going to show you how to plot, not how to write, but how to plot an academic paper. So I'll keep coming back to this idea of a story, which I think is relevant no matter what kind of paper you're writing and no matter what area or what field you're in. One tip that I will share with you is that you need to decide what story you want to tell before you start writing. And there are a couple of good things that people taught me early in my career. And one is to imagine that a microphone has just been put in front of you and you have to go on live TV and explain what the story you want to tell is. And I think if you try that, you will quickly find that you may not be completely clear about your story and you need to go back. So practice over and over to try to figure out what it is that you want to say about your art, it is you want to say about your research in quality and safety. So a good tip is to write the abstract first. Lots of people leave the writing of the abstract to the end. I think it's a good idea to begin with it, but it's something you'll have to keep as a live document that you keep revising over and over. And I'll come back to the idea of the abstract a little bit later. The second thing you need to decide is where you're going to tell your story. And one of the good things about writing in quality and safety is that you've got a number of different options. So if you're going to write about quality and safety in healthcare, one set of journals that you may wish to target are those that are relevant to your professional field in medicine or some of the allied healthcare professions. And these are a very good choice for many topics to do with quality and safety because they tend to have very high impact. So they tend to be very good for exposing your ideas, your findings to a wide public. They can be very helpful if you're a doctor, a nurse, a physiotherapist, a pharmacist, somebody who's looking for a career in healthcare, and you want to show that you are contributing to your own field. So these can be very good choices. There are some downsides to writing in medical and health journals. As we'll see a little later, they can be very, very competitive to get into. And a further frustration for some people can be that they're often a very short word limits, sometimes just 2,000 words. And for some kinds of papers, maybe particularly qualitative research or where you need to give a lengthy account of your findings, that can be very frustrating and difficult to deal with. Another choice you have to make if you go into writing for a medical or health journal is deciding between a specialist or a generalist journal. So let's just talk a little bit more about that. So one place where you can increasingly get articles about quality and safety published is in the big high-impact medical journals, the ones that everyone knows about, like the New England Journal of Medicine, the British Medical Journal, JAMA, The Lancet. Increasingly, these big journals will take articles about quality and safety. But there are also big, high-impact specialty-specific journals, and you'll know the ones for your own field, but something like Pediatrics, the Journal of Advanced Nursing, and so on. These will be specific to your area, and these can be really good if what you've got is a message that's really quite specific for your professional group and you want to get it out to that group. The third kind of area where you may wish to place your paper is in the quality and safety journals. And we're now seeing a really interesting group of these journals appear really over the last 10 years or so. One of them is BMJ Quality and Safety, which I'm very privileged to help edit. So a lot of what I talk about today is going to be based on my experiences of helping to edit that journal. But there are others, Implementation Science, the Joint Commission on Quality and Safety, the Journal of Evaluation of Clinical Practice. There are others. So you've got quite good choices there in terms of the health and medical journals. Another place you can put papers about quality and safety is in the social science journals. And again, these can be very good for credibility if what you're trying to carve out is a career in social science. And if you are a social scientist, they can be really very intellectually satisfying to write because you've got longer word lengths, often 8,000 words, or some journals will allow you even more. So that means that you can explore your topic in depth and you can bring a kind of theoretical perspective to bear, which you can't always do if it's just a short paper. On the other hand, they can be really very demanding to write. And need a lot of theoretical sophistication if you're going to get accepted. And a further unfortunate feature is that sometimes they are more limited in terms of impact, not always, but the social science journals tend to have lower citation indices and just for one reason or another don't always get the same level of publicity. There are some exceptions. Social Science and Medicine is pretty much the highest, the most cited social science journal in the world. And sometimes individual papers will fly and pick up a huge amount of attention from the media. In terms of choosing a journal, this is something you really should do at an early stage in terms of writing the paper. And there are a number of things you want to take into account. One is it high impact and high status? If you're just starting out in a career, you can certainly try some of the high impact, high status journals, but you have to be prepared for disappointment because they accept so few papers. But ideally, most people want to get their papers into a high impact, high status journal. Another thing that's really very important to think about is the databases that your paper will be indexed on. So some databases pick up a lot of these quality and safety journals, but not others. So if you're going to make sure that your your paper is going to be picked up by people searching in the area, then make sure that it's going to be indexed on the databases that they will be looking for. Medline, for example, has actually quite poor coverage of a lot of health journals that aren't medical journals, and quite poor coverage of a lot of social science journals. So think very hard about, is this journal going to reach your audience? An example would be you're trying to reach a physiotherapy audience. If you put it in something like anesthesia, will your audience ever actually see it? There are also the right requirements in terms of trying to tell your story. If the paper you're writing really does need a theoretically sophisticated approach, then putting it into a short medical journal may just frustrate everybody. Another thing to think about is how quickly the journal can turn around the decision and how quickly it will get your paper to publication. Some journals take a very, very, very long time to get the paper out, up to 2 years in some cases. And if it's really important that your paper is published urgently, then that might be something that you want to take into account. A lot of journals nowadays very helpfully will put the paper online as soon as possible after it's accepted, and some indeed will put it online even in its manuscript form. So being aware of your audience is one of the things that I would emphasize very, very strongly. When we get articles in that we find difficult to accept, it's often because for a health and medical journal, we're looking for a set of practical messages. We want to know, how is this going to make the world a better place? And if you haven't managed to hit that, and this is a kind of airy-fairy piece, then it may be less attractive to the kind of journal that you've submitted it to. If it's a social science audience, then the social science audience is going to be looking for evidence that you understand the theory, that you have mastery of the theory, and that you're making a contribution intellectually as well as in terms of the practical messages that you may have as well. One good tip is, if you're going to use concepts, do explain them. When you've been writing and working on something for a long time, it's easy to assume that everybody understands as much as you do, but often we won't. So it's a good idea to explain them. But whatever you do, always prioritize clarity. Clarity is probably the biggest problem we have with a lot of articles that I see as an editor. So one of the things you will need to do is to fit the structure to the study type. So the IMRAD structure is the basic one for most health journals, and that stands for Introduction, Methods, Results and Discussion. So we'll be talking you through that in a moment. That's kind of, in a way, the basic structure for most articles that you publish these days. But for many study types, there are specific guidelines which you will need to follow. So, for example, if you are going to publish a clinical trial, then it's really well worth looking at the consort guidelines. And I've given you the link to the website there, which specify what you would be expected to put in an article describing a clinical trial. There's also a very useful website called Squire, which explains how to write a quality improvement report. And that will be very relevant to many of you writing articles about quality and safety. And again, I've given the link to it there. Don't forget the abstract. Very often that is the last thing that's written by the authors, and it's obvious that they will have spent a lot of time on the main text of the article. The manuscript may be very nicely put together, and then there's a sort of rush over the abstract at the end. And that really is a big mistake. So as an editor, the first thing that you look at is the abstract, because you're trying to get a feel for whether this is an article that looks potentially interesting. So you're using it basically to screen candidates. Some editors don't look past the abstract. Once they have looked at the abstract, they make a decision there and then on whether to read further into the article. And also, if the paper is selected to go out for external review, then the abstract is the first thing that the referee sees as well. So it very much sets the tone. And the final thing to remember is that on the electronic databases that people search, very often the only bit of publicly accessible aspect of your paper is going to be the abstract. So it's a very important face, if you like, for your paper, and you do need to put a lot of effort into it. It's the thing that you really need to kind of keep going over and make sure you've got it right. So let's look a little deeper into how you structure a paper. Now, the introductions to papers that we see on quality and safety are often not well put together. So what we're looking for in an introduction is something that's going to intrigue the reader. So what you want to do with the introduction is not demonstrate that you have read every single paper that's relevant to the topic of your paper, but instead make us think that there's a problem that requires solving. Don't go on too long. Get to the point quickly. So we don't want a lot of throat clearing and a lot of long preambles. What you want to do is get in and make it clear that there's a problem that this paper is going to tackle in an interesting or novel way. A lot of quality and safety papers start with what's pretty much the same boring introduction, which says something like quality and safety is a big problem, 10% of patients are injured in accidents, and it gives the same set of papers that have appeared in every introduction. So anyone who's reading about quality and safety knows all that stuff, and you can kind of cut to the chase a lot more quickly. So what we're looking for in an introduction is something general about the importance of the overall topic area. So tell us about that. The introduction, a brief introduction to the particular problem or content that you're going to address in this particular paper. And then this is really important, a statement of the purpose or research question for the paper. I can't tell you how many introductions I've looked at as an editor or a reviewer that don't actually tell me what the paper is going to do. And again, it's a basic mistake, but it's made surprisingly often. So always end your introduction by saying what it is that you're going to do. So it's really important that the introduction then isn't just a kind of boring summary of the previous literature. Really, this is the opportunity for you to have a voice and to make the literature work for the story that you're trying to tell. There's no point in even mentioning literature unless it directly contributes to your story. Very often people use the introduction as an opportunity to show that they have read all of these papers, and actually as a reader you're just not that interested. You want to get to the point pretty quickly. In terms of methods and results then, again, the methods section tends to be an area where people fall down because they don't give a clear, explicit or honest and accurate account. Now, clarity is really important, so it's always a good idea to show your that section to colleagues to check on whether it's really, really clear. But the person who's reviewing it wants to know exactly what it is that you did. So being as clear and explicit as you can be. Sometimes people aren't fully honest, and what I mean by that is that they say that they've used particular types of methods when actually they haven't, and people who know the methods will know that that isn't the study design that they've used. And a good example in qualitative research will be people who say that they have done a grounded theory study, but then when you check what they've actually done, it's nothing like a grounded theory study. So it's not really an honest description of what they did, and it's not an accurate description. So if you're going to use technical terms like grounded theory or whatever it is, do make sure that you completely understand them and only cite literature that you have read and understood. Again, people have a bad habit of citing books or papers that they have not actually read, because if they had read them, then they would realise that they're misquoting them or they're using them inaccurately. The kind of thing I pick up a lot is people talking about something like data saturation or theoretical saturation, but they haven't really understood what that means. The results section, that's made clearer if you use subheadings, use tables and boxes as appropriate. You'll often find if you put a table or a box in, you can cut out quite a lot of lengthy description from the main text of the paper, so they're good devices. Be coherent and be concise. Easier said than done, but really, really important. The health journals and the social science journals depart a bit in terms of their conventions for the results. Generally, the health journals don't like you to include a lot of commentary or interpretation in the results section. They just want a bold account. In the social science journals, it would be more normal to include some kind of interpretation and reflection as you're going along. The discussion then, it's really helpful for the reader if you begin the discussion not by leaping straight into reflecting on what you've told us in the results section, but actually a brief summary that highlights the issues that you want to draw out. So at that point, what we like is a summary of the main points of the findings that gives you a really clear idea of what you think that your study has told us. It's also important in the discussion to acknowledge the limitations of your study, and that could include the sample size, it could include the response rate, it could include the study design, or many other features. But if you don't acknowledge the limitations, then you can be absolutely sure that the referees will point them out for you. And you ideally want to end the discussion section by coming to some kind of conclusion, so it's clear to the reader what the policy or practice implications are and what the directions are for future research. So we want to feel by the time we've got to the end of the paper that we've learned something new and that we now know how we should move forward. A lot of papers a lot of potentially very good papers end up in the bin because they're not clearly written. Good thinking and good writing are pretty much inseparable. And things like spelling, grammar, punctuation, sentence construction, these all really matter. If you get them wrong, then it means that the referees can get irritated, it means that they can become impatient with your paper when actually you're making good points, and it also damages your credibility. It makes you look a lot less persuasive than you would otherwise be. So again, it's really important that you get people to check over, people who are good on proofreading, so that all of those things are right. Spelling, grammar, punctuation, and sentence construction. A lot of the time what we're picking up is really long, over-complex sentences, run-on sentences where instead of a full stop being used, a comma is used. And one thing that's a particular bugbear of mine is using however as a conjunction. So I generally tell people to avoid using however unless you know exactly what you're doing because it's so easy to get it wrong. Another thing that really helps with clarity is using plenty of signposting. So it can be a bit off-putting to say something like, in this paper I will do this, 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 and this. But there are lots of ways you can do it which are a bit more light-handed and which allow you, I'll show you some examples in a minute, which allow you to explain what you're doing, then do it, and then summarise and reflect back on what you're doing. I find when I'm writing, using a lot of subheadings means that I'm much clearer about what points I'm putting together, which data I'm going to report under which heading and so on. And even if you end up deleting them later, using those subheadings as you're writing the paper can really help. Basic things like just one idea per paragraph and then try to transition seamlessly to the next one. Something that can be very irritating as a referee and an editor is repetitiveness. So just make the points once. Don't keep repeating them or bringing them up in another form later in the same paper. I think the hardest thing for people starting out with writing about anything, but quality and safety in particular, is how to structure the material. So organising your material into a coherent narrative is often the biggest challenge. So cutting so that you've got a really clean story. You don't have extraneous points, you don't have stray ideas. It's got to be a really clean story that somebody can sit down and read and think, I'm really clear what that person was trying to say. It can be very disheartening if you spent months and months collecting your data, analysing your data and so on, that you can't get to make this point or that point or include that particular piece of data. But really, this is why it's important to start with the story and then only include material that works for your story. Another thing that you need to do is have a voice that's consistent throughout. And this can be a particular challenge if you're writing in a team, which is something that we'll come back to a bit later. But having a voice where it's clear that you're in control of the material, you understand it, you feel confident about it, that they're really important. When you're drafting, I often go through 20 drafts, easily 20 drafts of something. So the first draft will usually be rubbish, and getting feedback on it from colleagues is often very helpful in figuring out what it's going to, where I need to take it. Sometimes I think it's going to be one type of paper, and by the time I've got to the end of the first draft, I realise it's actually something else. So it's constant redrafting. And this is why I think it's helpful to keep the abstract and the paper writing going at the same time, so that you're constantly going back to your abstract as a kind of roadmap, if you like, of where you're trying to go with the paper. Another thing I find really helpful is to try and get the whole paper onto maybe 5 PowerPoint slides, just down to bullet points, so that you understand what the story is. And it's a sort of variant on the microphone in front of a television camera technique, but it's just trying to get it down to what is the story you're trying to tell, and can you tell it cleanly and clearly. I'm going to say a bit about working in a team, because for a lot of people working in quality and safety, it's impossible to do this kind of multidisciplinary research on your own. For a lot of people, you're going to be working with other colleagues, and or you may be writing with your supervisor if you're a PhD student. And working in a team is absolutely wonderful, but it is also very prone to challenges of various kinds, especially when you're writing. One helpful thing you can do is decide on the provisional order of authorship up front, and this will avoid a lot of rows later, because if you have decided up front, then everyone is clear about who's going to be the first author and which place they're going to be. Now, it can turn out sometimes that although you put one person as the first author, it later turns out that somebody else has done far more of the work and far more of the writing. So you've got to be prepared to revise. But what will happen if you don't decide on the authorship at the beginning is that people will think that they have done lots of work and then haven't been properly acknowledged. And there really isn't any point in getting into that kind of unpleasantness when you can avoid it by deciding what it's going to be up front. Now, different groups work with different models of how they write together. In a lot of groups, they have a strong leader model. So what this means is that one person, usually the first author, takes responsibility for writing the paper and solicits contributions from other people who then write in response to quite specific requests from the leader. And that lead author will also seek comments and critical overview of their co-authors. A second approach, which can also work well but needs a lot of guidance, is a kind of federal approach where different people are delegated to write different sections of the paper. That can work very well because you're bringing the expertise of different people to different sections, but it does then need somebody to go through it at the end to make sure that the voice remains consistent and it's all in the same kind of style. And I think you need a strong leader who's prepared to make the decisions regardless of what model you use. One thing I can't emphasize enough is not to submit any paper unless everybody has agreed and seen the final version. Again, there are journals that consider it misconduct if you submit a paper without everybody having explicitly agreed, and there have been some unfortunate cases of people later getting into rows because somebody on the writing team didn't agree with the final version that was submitted. So do make sure that you have got explicit agreement from everyone that the paper is ready to go and that they have agreed the final version. Equally, when you get the comments back from the referees and the editor, it's very likely you'll need to make some revisions, and again, very important to make sure that you've got agreement on any subsequent revisions. Something that can be very, very helpful, increasingly these days, health journals are asking for statements of contributorship. And what that means is that each person on the team is asked to state what they contributed. So that could be you led the design of the study, you led the data collection, you led the interpretation, whatever it is. But it's actually useful to do that even if the journal doesn't require it, because then you've got a record of what people did if an issue arises subsequently. There is some formal guidance on how you determine things like authorship and contributorship, and that's well worth referring to. So the International Committee for Medical Journal Editors is a particularly useful source of guidance, and that's very clear about what it is that you need to do to qualify for authorship. And it's not enough to simply have gone to one or two of the meetings and not to have made a substantial contribution to the paper. That's really what you're looking for. So it's a good idea to describe every author's contribution, even if it's not required by the journal. When you're preparing a submission to a journal, this sounds very basic, but you'd be surprised how often it doesn't happen. And that is, make sure that you address journal-specific requirements. Almost every journal has its own set of requirements that you've got to satisfy. It will have its own referencing system. It will have its own ways it wants things laid out. It will have different requirements on whether you submit anonymous versus non-anonymous manuscripts and so on. And it's really quite insulting when you get a paper in where the authors have not gone to the trouble of working out what it is that your journal wants, and it's quite clearly been to another journal first, and the authors haven't bothered to turn it around and comply with the requirements for your journal. So basic, but really, really important. So do make sure that your references are in the correct system, comply with any requirements, and delete any hangovers from previous submissions. Make sure you get the acknowledgements right. You'll often have to acknowledge a funder, but also colleagues who've contributed, and that may be in the form of feedback or whatever. It's always a good idea to check with people that they're happy to be acknowledged. Check or keep a note of when you submitted the paper. Journals can take a long time to turn things around. Usually I think it's okay to approach the editorial office after about 3 months and ask nicely if there's any news of your submission. An unfortunate fact of publishing in quality and safety and pretty much every other field is that you have to be prepared for a lot of rejection, and often prepared for harsh words too. The major medical journals are now rejecting 95% and up of all submissions. My quickest rejection was in 20 minutes from the BMJ. So within hours of receipt would be generous for some journals, but they will often reject pretty quickly. The major social sciences journals are rejecting 80% and up. So again, it's hard to get these papers in. It is possible to appeal if your article is rejected. Generally, only appeal if you're really, really sure of your grounds, and it's an issue like the referees have made some mistakes in their review of your paper. It's probably worth pointing out by way of comfort that most articles are rejected 3 or 4 times before they end up getting published somewhere. So you may have to knock on a few doors before you get published. Referees' reports are often a quite difficult thing for people starting out in writing to cope with. Usually the referee won't know you, so their comments aren't personal, but they aren't always written very kindly, shall we say. And so they can seem very hurtful, very scathing, very scolding, especially the first few times. Now that I'm old and have seen many of these, they don't wound me anymore, but certainly they can provoke a very strong emotional reaction when you start getting them initially. And it's really important to try to move beyond that emotional reaction and try to work out how you're going to respond to them if the editor invites a resubmission. Sometimes the referees' reports will seem incompetent or perfunctory, and that's because, unfortunately, sometimes they are. Some referees comment on things that they don't know about. Some referees are not sufficiently explicit. Some referees don't work very hard, shall we say, at doing the job of refereeing. But that's I think relatively rare, and most of the time referees' reports will be really, really helpful to you in revising your paper. It will unfortunately also be the case that the referees will make very good points, but they contradict each other. So you have to, when you're responding to the referees, you need to think about how to handle that. And one of the things I would emphasise is that you don't have to do everything the referees say. You can respond by saying, I think they've made a good point, but we can't change our paper, or it's not appropriate to change our paper in response. So when you're responding to the referee's reports, you do need to amend your paper where appropriate to address the points they've raised, but you don't have to do everything that they've suggested. What the editor will really, really value is getting a point-by-point explanation from you. Sometimes you get a report back where the authors have not clearly explained what they've done in response to the referees, and then it can be a real bore to work out what it is that they did do. So what's really great is to have a table saying these are the points made by referee 1, by referee 2, by referee 3, and this is what we have done in response. And if they're numbered, all the better. If there are issues where you feel uncomfortable about changing your paper in response to what the referees have said, but you're open to negotiation about it, you can indicate that. Whatever you do when you're responding to the referees, be respectful. It's quite possible the paper will go back to them again for a further opinion. And you kind of need to make displays of deference, if you like. These people have given up their time almost always for free and looked at your work, and you need to acknowledge and be sensible in the way you respond. So always be thankful and grateful, because if it wasn't for referees, then the publishing world would stop. If you are rejected, which will happen a lot, think about where to go next. What's the next most appropriate journal for your paper? If you are lucky enough to be accepted, then you'll get various communications from the journal, and it's always very helpful if you're cooperative with copy editing and proofing and you get things back on time, because there'll often be a queuing system with the journal where they need to get particular papers in at particular times. You can also check if you can put PDF into your institutional archive. That may be something helpful to do. Put publication details on your website, your own personal website. And a good thing always to do is to check with the press office for your institution or the press office for the journal to see if it would be worth issuing a press release. There's a lot of interest these days in quality and safety, and you can pick up quite a lot of interest from the media, which is helpful to everyone. Things that can go wrong. Sometimes the team can fight over where to send the paper. Somebody might want to send it to one journal, somebody wants to send it to somewhere else. So that's the kind of thing you need to resolve at an early stage. Sometimes it's the case that the team can't agree a draft of the paper, and so that requires a strong leader who's going to facilitate discussion and try to bring people together. If the team can't agree on the order of authorship, you can get into some really quite difficult problems. And whatever you do, don't take those to the editor to resolve, because it just puts the editor into a difficult position. It's something that needs to be sorted out in the team. Very occasionally you get a renegade who goes off and submits the paper without checking it with everyone else, and then you're into a lot of difficulties. And another thing that can happen is that someone wins a point when you're drafting the paper, but then the paper ends up getting rejected because the referee supported another position. So these are, in a way, basic team problems, but they're the kind of thing to be aware of and to keep an eye out for. Okay, I'm going to move to the second part, but this is a short part of this presentation, by filling you in on how to plot an academic paper. So this is the most useful thing I have ever learned in terms of academic writing. So I'm very pleased to share it with you. And I actually got it when I went to a presentation on how to write children's books. And I realised that the 7 points that underlie narratives are the 7 points that underlie every narrative. And when you're trying to tell a story about quality and safety, it doesn't really matter what kind of paper you're trying to write, even if it's human factors or something, ergonomics. What you want is a narrative that everybody can get a hold of and understand. So this is how you do it. There are 7 points: problem, desire, opponent, plan, battle, knowledge, and new level. And I'll just very briefly take you through each of those. So the first thing you want to do in any paper is state the problem. Show us that there's some issue that really needs tackling, and introduce it in an attention-grabbing way if you can. So you need to make it an interesting problem. So show us how it's obstructing the achievement of important goals, like keeping patients safe. Link it to a policy or practice objective, like improving the quality of care we give patients, or improving patients' engagement in their care, or show how it affects people's lives. So an example would be 70 people a week have their feet amputated in England. That's a pretty startling statistic, and it's linked to all three of the things that we've just mentioned. So make it interesting. The second thing then is to express a desire. So your desire is to put the problem right in some way, and you do that by formulating it as a clear research question. So at the introduction sections of the paper, you may be working up towards posing that question. So you need to use the literature strategically, as I was saying earlier, to make sure that we understand why it is, what the background is to this problem, and why it's such an issue. So a good research question is clearly stated. It's well defined, so that's part of what you'll be doing in the introduction and in your use of literature is defining your terms, and is orientated to solving an empirical or theoretical trouble. The next thing you're going to have is some kind of opponent, and this is something that's standing in the way of resolving the problem that you've just identified, and usually that will be some gap in the literature. So you can say something like 70 people a week have their feet amputated in England, but little is known about why this happens, or previous studies have not adequately addressed this problem. So therefore, you're now positioning yourself to be the person who's got the plan to solve this problem. So everything you're doing with the literature has to work to establish the problem, the desire, and the opponent. Don't list studies and say what they say. That's just really boring and doesn't help you build the argument. Don't start sentences with the name of the author generally, because that actually encourages you to list authors. So you need to marshal the literature effectively, identify ways in which you can organise it. Something that can be a very clever trick is to generate your own labels for these, and using devices such as numbering. So I've given some examples here. You can say things like 4 major approaches to explaining non-compliance with infection control can be distinguished. Or one way of understanding non-compliance is to examine behaviours. In this article, we propose an emphasis on values instead. Once you've completed the introductory phase, you want to move to a plan. So having convinced us there's a problem, outline your plan for addressing it. And that needs to be a plan that's well suited to addressing the problem. So a study design that really is convincing. The next stage is the battle. And this is really where you're describing what happened in response to your attempts to implement the plan. So it's not always going to go perfectly. You may have decided to use one type of study design, but it didn't really work out that way. You may have decided to do a big survey, but you end up with a poor response rate. So tell us anything that might be relevant to understanding plan implementation. The next stage then is the knowledge that you have gained as a result of your executing your plan. So this is the results section. You need to present these authoritatively, clearly, and in a logical sequence. So what's good here is to have a plot that keeps us interested. Put things in tables if needs be, but then don't describe it all over again in the text. So you don't say things like Table 1 reports. Finally, you get to the new level, and this is your discussion. So start by restating your main findings, reflect on the new level that you've reached as a result of your plan and the battle to address the problem, link it to what's already known, acknowledge the limitations, tell us about the implications, what needs to be different now, and say what more needs to be done to sort out the problem. So by using those 7 steps, you should be able to structure pretty much any paper so it follows a plot. Just a couple of things to finish on. One of the things you need to do most as an author is develop an authorial voice. So you need to be confident and in control of the material, so we know you're worth listening to. So things like explaining your argument at the beginning is a really helpful kind of device. So something like, we'll explain that non-compliance is best understood as a problem of legitimacy rather than one of unprincipled cognitive lapse. That's a kind of long and technical sentence, but if we know where the argument is going, we can follow it more easily. Sometimes a short interjection from time to time can really help. So I'll just give you one example there, the middle one. So-and-so's approach offers the most thoroughly informed critique of cognitive lapses. So that's the authorial interjection where you're saying, making some kind of comment that's relevant to the material you're introducing. And often you will want to use sleights of hand. So when there's a huge literature that you don't want to have to summarize, but you want to show that you know about it, you just kind of use a sleight of hand. So you say something like, among the many approaches to conceptualizing non-compliance, so you're acknowledging that there are many, those that address professional values are most persuasive. That's an example. Signs of an amateur, the last thing I will finish on. This is using the literature in clumsy ways. So in 1993, so-and-so said that's a sentence that should never appear. The date when they said it is usually not relevant, and really what we want is some kind of sense that there's an argument developing. Using dollops of literature, so it's transitioning very clumsily from one thing to another. Claiming that your work is far more original or significant or important than it really is. Describing but not conceptualizing, so not offering us a clear way forward, and being too passive, so it doesn't sound as if there's a really strong authorial voice at work. I hope that's been helpful. I'm now very happy to take questions. Thank you very much. Over to you, Bill.
Mary, thank you very much indeed. I've got lots and lots of comments here. And so I'm going to move from the big picture questions through to some tips and tricks type questions. And let me start with a big one for you. It's come from a couple of listeners. One, does writing about value follow the same guidance as quality and safety? And then another version of that, are there any particular differences between writing about quality and safety and writing about other types of clinical work? And particularly inspired by your children's stories framework, I think people would just like to get under the skin of understanding what's different about quality and safety.
Okay, they're great questions. I think a lot of what I've been doing this afternoon are presenting principles that are likely to work no matter what you're writing about. So I think a lot of what I was saying, the importance of agreeing on the theme, the authorship, how you write a story, these are all relevant regardless of topic. So I would say just as relevant to value as anything else. When you're writing about quality and safety, some of it goes back to what I said at the beginning about choice of journal. So if you're writing about a quality and safety issue for a journal that is in the specialty area but is not a quality and safety journal, you may need to do a lot more to explain some of these ideas up front. So an example would be in human factors, which is a very big thing in quality and safety. They often use the term non-technical. So they would talk about the non-technical aspects of human factors. And this means absolutely nothing to somebody who is working in, we'll say, physiotherapy. That's an idea that you would need to explain. Equally, if you're writing about quality and safety in a major medical journal and you need to use some terms from social science, you may have to do quite a bit more explaining first. So I think quality and safety in some ways is an easy thing to write about, and in some ways is quite tricky because you're usually serving these different audiences, and so you may need to move quite a bit depending on who you're writing for.
Thank you very much, Mary. Now some technical questions. Are there proofreading firms that one can use to appropriately help you improve your submission?
I believe there are. There are issues about using external people to help you write your paper, which are worth being aware of. So again, the website I referred you to in the middle of the presentation, Medical Editors Guidance, has some advice on ghostwriting. So there's a sort of spectrum here. There isn't a problem about paying somebody to proofread your article as long as that's what they're doing, simply proofreading and checking that your grammar, punctuation and spelling are all correct. Once it moves into something more than that, where they're helping you write the paper, but they don't appear as an author, then you're into something that's a bit more like ghostwriting. And there are ethical guidelines covering the disclosure of ghostwriters, and it's becoming an issue, even in quality and safety work, because of the involvement of of people who aren't disclosed as being authors in some papers. So yes, it's something you can do. I generally prefer to ask colleagues or trusted friends to do proofreading rather than go to a company. But if you don't have that, if you're working in a country where perhaps you don't have access to too many English-speaking colleagues or whatever language you're writing in, you could go externally, but just be careful.
Thank you. Is it acceptable to submit a paper to multiple journals at the same time?
Absolutely not. That's considered quite a sin by us editors. There are several reasons why you shouldn't do that. One is that it could be accepted by more than one journal, and then you've made an ethical dilemma for yourself, because it will then appear twice on the databases and so on. But a second thing is that you're exhausting the goodwill of the refereeing community and the editing community. And so it really isn't something that you should do at all. Linked to that is the issue of writing slightly, or using the same material in different papers. So it's effectively duplicate publication, writing up the same study, or sometimes known as salami publishing, where you slice up the same study into lots of different slices, but it's really the same thing that you're reporting over and over again. That's also considered something of an ethical lapse.
Thank you. That's very, very clear. Now, a couple of questions to do with the psychology of rejection. At least 3 people have specifically said thank you for this session. They found it very useful because they're reassured to hear that it's normal for papers to be rejected 3 or 4 times. But one particular line of inquiry was about the delay in receiving reports on your article, and a suggestion about whether or not it wouldn't be possible for editors to send them through as they come, rather than sometimes waiting to get 2 or 3 reviewers before sending them out. Is that something that you as an editor might consider?
Okay, that's an interesting point that hasn't been made to me before. I'll just explain a little bit about being. So I'm an associate editor. I don't get to make the final decision on the papers that I review. But what happens to me is the editor-in-chief will assign me a paper to manage, and I then have to go out and find referees who are appropriate and well qualified to comment on the paper. And then when I get those reports back in, I then summarise the comments, I add my own comments, and I make a recommendation to the editor-in-chief. And that's the way most of the big medical journals work these days. There are some smaller journals where the editor, him or herself, is making most of the decisions, but a lot of them operate this associate editor-in-chief model. It often takes me 10 or 11 goes to get 2 or 3 referees. I think my record was 20 attempts to find referees for a paper. Because I'm approaching busy people, they often have many requests to do refereeing, and it's a thankless job, to be honest. It's one well worth doing if you're setting out in your career. To get experience of what papers look like, and it's very, very good practice. It's a very good thing to do, but most people can't handle more than 1 report a week. So if they've got lots of requests coming in, they just turn them down. So it can take me quite a long time to find referees. Even when I've identified them, they can then take quite some time to return a report. I think if I don't feel happy about making a decision without 2 reports, and I prefer to have 3. And I don't think I would feel happy about sending the referees' reports back as they come in, because that's without the benefit of having made a considered decision. So while I can see that there could be some benefits to it, it's something I think generally I feel less comfortable about. I'd rather give the authors the benefit of a more considered decision, I think.
Okay, thank you. Now, a request. Could you say more about how to reconcile contradictory reviews? This person clearly having received several examples where reviewers contradict themselves.
Yes, I think we all have as authors, and it is tricky to deal with. when you get into a situation where you really cannot figure out what you're supposed to do, I think it is worth dropping the editor a line, separate from the formal resubmission, and saying, look, we can do this, this, and this, or we can do that, that, and that, but we can't do both. Can you give us some steer on what you'd like us to do? And often editors will be very helpful in that situation because it's one they recognise. If it's not possible to do that, then you kind of have to make a decision about what you're going to do. And as editors, we would much rather get a clean paperback that's coherent and makes sense rather than one that's been turned into a mongrel because you've tried to satisfy too many masters. So I think just pick the comments that you think you can agree with, that seem helpful and constructive and that you can respond to. But don't be afraid of challenge as well. So don't go necessarily with the ones that are going to be easiest to address.
Thank you. And a very specific one here. Have you got any more of Mary's hot tips on writing the results section for qualitative research?
Yes. Okay, so the writing qualitative research is tricky because it typically takes a lot of words, and it depends on which journal you're targeting. So social science journals, you can look at maybe having 4,500, 5,000 words. And in that case, it's good to have the quotations, for my money, embedded with the text. Because it makes for a much easier read from the reader's point of view and generally from the editors and referees' point of view. Some journals in the health sciences don't count words in tables, and so a lot of authors end up putting the quotations or the field notes or whatever into boxes in order to subtract them from the word count, and that can make it a lot more difficult to read. So I don't have an easy answer to that question. Generally, I prefer qualitative work that's doing more than simply describing. Sometimes describing is good, but I generally prefer something that's got some theory behind it and that's got some sophistication, and that, if you like, adds value because it's got that sophistication behind it.
Thank you. Just one comment from me. Just a reminder to you all listening that this is a session hosted by the Health Foundation, and it'll be possible to have a recording of it from the Health Foundation's website. We'll email all of you and give you that link. Or if you simply want Mary's slides, you can go to the registration site and download those after this webinar. We have 5 minutes left, and a comment from a listener, Mary, adding another aphorism to the one you've offered already. It may be useful to keep this one in mind. What the results section giveth, the methods section taketh away. Thank you very much for that one. And somebody coming back to your suggestion about becoming a referee wants to know practically how can you volunteer to be a referee, if that's a really good way of getting experience. Could you help us there, Mary?
Okay, well that's a good one because we're always looking for referees, and that's the big challenge. If there's a journal you are interested in refereeing for, there will almost always be a journal address. Pop them an email and say you're interested in being asked to be on their referee database. Give a list of your keywords that describe your interests, and then wait for the request to roll in. It's a really very good thing to do. That's in fact how I started out in my editing career, was being asked to referee some articles, and the editors who I was doing that referee for liked what I was doing, and that's how I ended up being asked to in my early days to join an editorial board. So, and I've taken it from there. So it's really excellent experience, and I'd strongly recommend it to anyone. Another thing you can do if you want to be invited to be a referee is on a lot of, particularly the BMJ journals, you can register both as an author and as a referee. And when you list your keywords, then when we as editors are going through, and if I'm looking for somebody who can do qualitative and medication errors, and that's what you've registered, you'll pop up as somebody I should invite.
Thank you, Mary. A question now specifically in the quality area and referencing the Squire guidelines.
Yes.
Would it be a reasonable assumption that a paper written according to the Squire guidelines would be evaluated as a better paper and more likely to be accepted?
I think the Squire guidelines are really helpful, and again, in a way, they're a bit like the principles that underlie good writing. It depends a little bit on which journal you're targeting. Some journals don't know about them. If you're going to go for something like obstetrics and gynecology or pharmacy journals, they just may not be aware of them. If you're coming to the specialist quality and safety journals, they will be aware of them. And it's very helpful in your covering letter to the editor to point out that you have used them and that you've structured your paper according to the guidelines. So I'd certainly recommend having a look at them and thinking about how they can help you with structuring your paper. A lot of work went into those guidelines, and I think they really are very helpful.
Thank you. Another technical question coming back to something you said earlier. When looking at the criteria for the order of names, after the lead author, are there traditions for the ordering of the other authors, and how do you decide that?
Okay, great question. This is something that sounds very unusual to people who write for social science journals, but in medical journals, the last author is generally considered the senior author. And this, for example, in a PhD student setup, could be the supervisor, whereas the student would be first, or it could be the principal investigator on a grant, even though the paper has been written by somebody on the team. So the last author has a special position. After that, it really gets quite interesting as to how you allocate authors. Some groups and some journals will order the subsequent each author after the first one. If you imagine it a kind of sandwich with the first one and the last one, they will order it according to order of contribution. But it's often not very easy to figure out what this is. So some people use alphabetical ordering. It's not straightforward, and it can be the source of considerable anxiety and conflict within teams. And I tend to think this is why it's actually worth talking about at the very, very beginning, so at least people are agreed on what is the criteria that they will use.
Mary, we're very nearly at the end of our hour. That's been absolutely fantastic. Just one last question for you. If you had to give a Mary's tip of all tips, what would your top tip to any aspiring, interested author be to help them get their writing published?
I would say get your story straight. So it's clarity and making sure you've got an interesting story to tell. Editors are constantly looking for a good story. They're looking for something that's going to make a difference to the area that they're working in and that's going to appeal to their audience. So a good story. Thank you very much.
Mary, thank you very much. You've told a wonderful story. You cut to the chase, to use your own language. There was virtually no throat clearing. You've been memorable, insightful, really, really helpful. You've set the bar very high now for the Health Foundation. Our next webinar will be on the 27th of January at 3 p.m. UK time. We're absolutely delighted that continuing this theme, Harvey Shojania, the editor of the BMJ Quality and Safety Journal, will be our guest speaker. We're extremely grateful to all of you, the many of you who've taken time and effort to give up an hour now. And for those of you who've contacted us, we'll do our very best to respond to the comments that you've given us. Just a final reminder that the slides will be available shortly. They're not there right now, but they'll be available very shortly on the conference registration site. And that in a few days' time, we'll be delighted that a recording of this will be available on the Health Foundation site. So it now just remains for me to ask everybody listening to do the equivalent of a round of applause and to thank Professor Mary Dixon-Woods very much for a wonderfully stimulating talk. Mary, thank you very much.
Thank you all for joining me. It was a great pleasure. Thank you.